I'm Dr. Amrin Singh, fertility and IVF consultant. So today I want to talk about a very important topic, that is the age of the couple and the success rate of IVF and why it is so that the success rate of IVF decreases with the age. So here we have to understand one important factor, that the success rate of IVF procedure depends upon the quality of the eggs and the sperms which we retrieve from your body. And according to research, we know that when the age of the couple increases, especially in females, the age of the female is directly related to the quality of the embryo. So the age and the success rate of IVF, why it is related? So here we have to understand one normal thing. Euploid embryos and aneuploid embryos. Euploid embryos are those embryos which have normal set of chromosomes in them and they lead to successful pregnancy most of the times. And aneuploid embryos means the chromosomal numbers are abnormal in those embryos, or there may be some other problems in the chromosomes of those embryos, that may be translocation of the chromosome, duplication of the chromosome. So in a normal language, if you want to understand that those embryos which have normal chromosome and which will give birth to healthy baby are called euploid embryos, and the aneuploid embryos in which the chromosome numbers are not normal, and if these embryos are implanted in your uterus, they may result in negative success rate, they may result in abortion, they may get implanted and they may also grow. But the baby which is born from these embryos may have abnormalities like Down syndromes, Turner syndromes and many other chromosomal abnormalities. So now here we have to understand that the aneuploidy rate increases with the age. So when the age of the female increases, the number of aneuploid embryos increases. So you have to understand, when the age of female is in her 20s, the aneuploid embryos are just 20%. The aneuploidy rate is only 20%. But when the age is more than 35 years to 45 years, the aneuploidy rate increases from 20% in 20s to 35 to 45% in the advanced age. So that means when the age increases, the number of abnormal embryos increases. And why this happens? Because when the age of that female increases, there is some abnormality in the spindles. Spindles are the structure which are present inside the chromosome, and because of the abnormality in these spindles, there is the abnormal division of the chromosome, and then this leads to abnormal egg and abnormal embryo, and this abnormal embryo gives rise to abnormal baby. So now you have to understand that why the age is related to lower success rate and why we encourage couples with the higher age group to undergo IVF, but to do the genetical testing along with that. So if your age is more than 35 or 40 years and your AMH is good, then what we can do is we can do your IVF cycle, and then we can wait for the embryos to grow up to the blastocyst stage, that is day 5 embryos, and then the genetical testing from the biopsy of these embryos can be sent to the lab, and we can see which embryo is normal and which one is abnormal. And only the normal embryos has to be transferred to the uterus. And now many couples, they ask me, "Ma'am, my AMH is very good. Even though I am 42 years of age, then I will have a good chances of having normal embryo after doing the biopsy." But now you have to understand one more thing. The accretion rate. Accretion rate means when we do the fertilization of the egg and the sperm, the embryo is formed. So this embryo goes through the stages from day 0 to day 5. That is from day 0 to blastocyst. And the blastocyst is the stage when we take the genetical testing. We take the biopsy. But in the higher age group, the accretion rate from day 3 embryo to day 5 embryo is very, very high. So when the embryo is at day 3, but the lower chances will be there that this day 3 embryo will go up to day 5. So here comes the tough decision. So when we have day 3 embryos in our hand and we are waiting for them to go up to the blastocyst, so there will be chances that none of them transform into blastocyst, and there will be lower chances that they will convert into blastocyst and we will be able to take the biopsy. So, and the other question comes that the age of the husband, does it affect the embryo quality and chromosomal abnormality in the embryo? So yes, this research says that there are 8% chances that the abnormality in the sperm lead to the chromosomal abnormality in the embryo. Although the chances are low, but other researchers says that when the male age is more than 40 years, that also directly correlates with the success rate of the IVF, the quality of the embryo, and the overall success of the IVF. So here we have to understand very important thing, that the age of the couple, the father and the mother, or you say the female and the male, is directly correlated, is directly responsible for the success of the IVF, because the embryo quality depends on both the gametes, the sperm and the egg. Thank you so much.